Hi, Dr. Smith. Yes, I take care of baby HLH. Yeah, he already started chemo. Oh, you want to add something? All right, let me write this down. So you want to add rituximab. Okay, so you want rituximab. What's the dose? 375 milligrams per meter square per dose. Okay. How often do you want this? Just day one of a 28-day cycle. Okay. All right, perfect. So let me repeat that. So you want rituximab, 375 milligrams per meter square per dose on day one of a 28-day cycle, correct? All right, perfect. I'll go ahead and make that change on the roadmap, and then I'll just go ahead and shoot you an email and verifying so that you can verify that this is the dose that you want. All right, thanks. Hi, Webster's Dictionary defines communication as the imparting or interchange of thoughts, opinions, or information by speech, writing, or signs. It is important to consider that communication is not just in a verbal form. One study states that 93% of communication is more affected by the body language, attitude, and tone, and leaving only 7% of the meaning and intent based on the actual words said. Whereas the spoken words contain the crucial content, their meaning can be influenced by the style of delivery of the speaker, how they stand, how they speak, and how they look at a person. In today's healthcare system, delivery processes involve numerous interfaces and patient handoffs among multiple healthcare practitioners with varying levels of education and occupational training. During the course of a hospital stay, a patient may interact with a variety of employees, including physicians, nurses, technicians, and others. Effective clinical practice involves many instances where crucial information must be accurately communicated in the healthcare system. Team collaboration is very essential in the healthcare system. When healthcare professionals are not communicating effectively, patient safety is at risk. There are some examples where patient safety is at risk. Like, for instance, we have the lack of critical information being passed along. For example, a night shift nurse does not pass on that this patient had a reaction to platelets and therefore needs pre-meds before we give them platelets. The day nurse, not knowing this information, could possibly give platelets without pre-medicating the patient prior to that. Misinterpretation of information that's passed along as well. We assume that what we are hearing is exactly what the person's saying. Sometimes it is not the way a person is trying to communicate to us. There's been many a times where I misunderstood the way my manager was talking to me. And I interpreted one way, she interpreted a different way. So that can lead to patient safety issues as well. Another one is like unclear orders over the telephone. Usually when I receive orders over the telephone, I usually repeat back. We have the read back system that we must do at our hospital, meaning that if a physician gives me an order over the phone, I will repeat exactly what the physician has said back to them and ask if it's correct, as the example that I have shown earlier. Sometimes we can overlook critical changes in status. For instance, we may overlook, a nurse may not tell the physician that the patient has voided 1,000 mLs of urine, and the physician goes into the computer and looks and sees, oh gosh, the patient hasn't voided, let me order some Lasix. That can be an issue for patient safety. My job as a clinical research nurse is to keep the schedule of the patient's chemotherapy regimen. What that includes is I take a roadmap. I keep track of when their chemotherapy is administered, and I have to make sure that if their chemotherapy is not administered, the reason why. Sometimes patients react to their chemotherapy, and we should be the ones that are notified so that we can change on the roadmap and probably just make a little notation that the patient had an allergic reaction to a certain drug that they received. Without this communication from the MDs, we won't be able to do that. We will not know if the patient had an allergic reaction or not. And if we don't document it on the roadmap with a medication change, then the next physician who comes in as the attending for this patient may just go ahead and order the same chemotherapy without knowing that this patient had a reaction to it. So communication in the workplace is very important. Communication is big, I think, because if you have great communication, then you feel a little bit more involved with what you are doing. It makes me a little bit happier at what I'm doing, that I am able to communicate with the different teams. The different teams that I do communicate with goes from the physicians, of course, it goes to radiologists, the laboratory, etc. Patient safety is the biggest thing, a most important thing that we should all be thinking about. It is important for me to know that if I need to see changes happen, let's say that, for instance, medications documentation, if the physician doesn't do their medication documentation, how can I know whether the patient has been taking their medication or not? So it's important for the communication between us and the physician to make sure that things are getting documented correctly. In our institution, we do have numerous problems with the oral chemo medications that are given on an outpatient basis. Our physicians expect us to keep track of the medications on the patient's roadmap, but yet they fail to document the medications themselves on the med reconciliation form, which is what they are required to do. Missing medications is so detrimental to these patients who have cancer. So it is important for us to document. And documenting too is a way of communicating as well. I'd like to say that hopefully one of these days we'll all have effective communication in the work field. But in an effective clinical practice, we must not only focus on the technical system issues, but we should also focus on the human factor. Good communication encourages collaboration and helps prevent errors. It is important for healthcare organizations to assess possible setups for poor communication and be diligent about offering programs and outlets to help foster team collaboration. By addressing the issue, healthcare organizations have an opportunity to greatly enhance their clinical outcomes. Thank you.